Ozone. High up in the atmosphere, it serves as a shield to filter out deadly radiation from the sun. But the two-faced gas can cause a wide range of health problems if it's on the ground level. The nation's growing yet often overlooked air pollution and the health risks it can cause. That's our news features tonight with Lee Unshin.
With scorching hot days and sticky tropical nights behind us, summer is coming to a close. But the season's warmth will stay around just a bit longer, as Korea is expected to have a monthly average temperature of some 20 degrees Celsius or higher throughout September. And with that, also lingering from summer is one of its seasonal threats.
Ozone gas is formed when sunlight causes nitrogen oxides and volatile organic compounds, known as VOCs, to react in the air. These chemicals come from many sources, like cars, factories, and consumer products. More than 90% of the Earth's ozone stays in the stratosphere, protecting us from harmful UV radiation. Nearer the ground, however, the chemical compound is not welcome.
When the ozone concentration reaches what's considered a harmful level, we send out alerts. Because it's a gas, masks don't help. When the alerts are sent, usually between late spring and early fall, around 2 to 6 p.m., it's important to try and stay indoors.
The nation's Environmental Research Institute keeps an eye on the ever-changing pollution levels. When the 8-hour mean exceeds 90 parts per billion, an ozone advisory is displayed on digital boards across some 20 cities and provinces. But the symptoms of ozone sickness are often overlooked.
I work mostly outdoors, but I've never cared about the ozone level.
I see the alerts, but I don't know how to protect myself.
I know that high levels of ozone are bad, but I don't know what specific damage it causes.
Doctors are warning against the effects of the invisible threat. Extended exposure to ozone can cause eye inflammation, and inhaling excessive amounts can lead to nausea, chest pain, and even respiratory damage.
Generally, those with allergies, conjunctivitis, or asthma are considered particularly vulnerable to exposure to ozone, along with infants, toddlers, and pregnant women.
Korea saw the harmful gas steadily increase over the past 2 decades. Less than 100 ozone advisories were issued before 2012, but now the number has surpassed 240.
Ground-level ozone is forecast to increase. To counter this, we need to track down which chemical substances among nitrogen oxides and VOCs are the main cause, and reduce the amounts of those chemicals, along with countermeasures to deal with a prolonged warm climate.
Even now, the system isn't considered ideal. Korea's ceiling for the normal ozone range, 90 parts per billion, exceeds the U.S. Environmental Protection Agency's standard of 70 parts per billion and WHO's guideline of 50.
These standards were built to safeguard the particularly vulnerable, such as patients with chronic respiratory or pulmonary conditions. Korea could also use a renewed policy direction for the pollution matter, aimed to cater for those people.
Unlike particulate matter known to cause long-term damage and even cancer, ozone does not accumulate in one's body, so it's considered less deadly. Still, in-depth studies across the globe into other health risks of the highly irritating gas are ongoing, alongside the traveling pollution's geopolitical impact. So as researchers suggest, why risk further problems later on when safety nets can be made beforehand? Lee Unshin, Arirang News.